Stroke is a cutoff of the blood supply to the brain, either because a clot is there or a bleed. When there is a clot or a thrombus, the patient can benefit that if he reaches a point where clot can be thrombolized, then the blood supply can be restored and many of the complications like paralysis can be prevented.
The government of Goa has also included the district hospitals for the stroke program. So the spoke hospitals are doing good job, especially for the stroke patients. Last year, India reported 1,85,000 new cases of strokes. This means every 40 seconds there is a new patient of stroke, and every 4 minutes there is a death due to stroke bleeding or stroke thrombosis.
This is regarding my father, who is now leading a normal life. But that day on 5th of September, he noticed numbness in his left arm and leg, and he is not able to move. When we reached Goa Medical College, we were given smooth treatment. I would like to thank the Goa Health Department and the Goa Health Ministry for giving us this free treatment and very effective treatment at Goa Medical College.
Because stroke occurs because of various, like a heart problem, it is basically a blockage of blood vessels which are supplying the brain or any rupture of that. So the risk factors remain the same. So if someone is having diabetes or someone is having high blood pressure, then they should control the diabetes, control the blood pressure with appropriate medicines and regular checkups. If they are having high cholesterol levels, and again control it with medicines and a good diet. A good lifestyle is very important. A sedentary lifestyle is one of the major risk factors for stroke. So they should have a good physical exercise, regular brisk walking, having a good diet, which is a fat-free diet, lot of water intake. All these are very important. One should not have too many addictions like cigarette smoking, tobacco chewing. They are one of the major risk factors for stroke. So that should not be done. Alcohol is also another major risk factor. So all these risk factors should be evaluated, and one should work on this, because if we go towards a healthy lifestyle, the chance of getting a stroke is very minimal.
So what do we do if a stroke does occur? If a stroke does occur, it is important that we recognize the symptoms of this disease and take appropriate measures immediately. The brain suffers a death in the number of nerve cells, of neurons, every second. So in a major artery occlusion, we lose millions of neurons every second. So every second counts, and every second we mean that we lose a part of our brain tissue which will never regenerate again. So it is important to reach your health facility as soon as possible.
The experience what we are having of using this clot busting medication in district hospitals in Goa, we have been using these injections from April 2023 under Goa stroke program under guidance of Goa Medical College, and we have found that patient who has come in window period means within 4.5 hours, whose scan has been done and there is a evidence of suspected clot in these patients, we have given this injection and it has shown a very good results.
So be fast means be for balance. If you're facing a problem in a sudden change in balance, in ability to walk and tendency to fall to any particular side, that might be a sign of stroke. A loss in vision, E stands for your eyes. A loss in vision in one eye or in both the eyes could be a sign of stroke. F stands for a facial asymmetry. So a droop in one side of the face could be a sign of a stroke. A stands for an arm drift, a weakness of one half of your body. It could either be the arm and the leg, or it could be the arm alone or the leg alone. S stands for a change in the speech, that is a slurring in the speech or a sudden inability to speak and or a sudden inability to understand what others are speaking. And last but not the least is T, which stands for time.
हांव तुमकां सांगूंक सोदतां की 4.5 वरां भितर जर तुमकां कसलेय स्ट्रोकाचे सिम्पटम्स जाले, स्पीड तुमकां उलोवंक जायना वा तुमची एक सायड चलना, हात चलना, पांय चलना, वा तुमकां दोळ्यान सारकें दिसना, वा तुमकां बॅलन्स प्रॉब्लेम जाता, चलपाक तुमकां फाटी पडल्या भशेन दिसता इमिडिएटली, आनी हे सिमटम्स रोखडेच त्या दिसा सुरू जाल्या विदीन एज सून एज पॉसिबल तुमी तुमच्या रिलेटिवाक इन्फॉर्म करा आनी ताबडतोब डिस्ट्रिक्ट हॉस्पिटलांनी वा गोवा मेडिकल कॉलेजीन या. इंजेक्शन आमी तुमकां एसेस करतली, इंजेक्शन दितली आनी जाता तितलें आमी गोंयकारांक हितूंतल्यान भायर काडपाक ट्राय करया.